Hi, everyone. Welcome to the White Horse Village COVID-19 vaccine information session. My name is Holly. I'm the Senior Director of Human Resources. And today we're going to talk about some key pieces of information regarding the COVID-19 vaccine at White Horse Village, White Horse Village's policy regarding the vaccine, some key pieces of information from the CDC, who will receive the vaccine first, frequently asked questions, next steps, and any questions you may have, contact Human Resources. For now, the White Horse Village policy is that vaccination is not mandatory. We're not mandating that team members receive the vaccine. That may change in the future, but we encourage all team members who meet the criteria and are eligible, meaning medically, um, that they should receive the vaccine. If you have an underlying medical issue, please speak with your doctor. If you have had an allergic reaction to other vaccinations, you should also speak with your doctor. But we do encourage everyone to do their due diligence, to visit the CDC website, to learn more about the vaccine so that you're making an informed decision and not just listening to misinformation and rumors. We want you to get the facts from the CDC and other uh, verifiable outlets who have access to key pieces of information and are the standard bearer for communicating that information to the country. So the COVID-19 vaccine was issued an emergency use authorization from the FDA that allows for an emergency use during health crises and pandemics, such as the one we're in now. They still follow the same safety standards. So there are phases in terms of the research, in terms of control groups. The same standard scientific procedure was maintained to find out if the vaccine is safe, if there were any side effects, and the effectiveness of the vaccine. So they still went through their paces with regard to determining whether or not this vaccine should be released for use. The emergency use authorization, or EUA as it's often seen, was granted first to Pfizer and then most recently to Moderna. So both of the vaccines require a 2-dose administration, a first dose for Pfizer, and 21 days later, the second dose. For Moderna, it's 28 days later. Both vaccines were tested on tens of thousands of adults, and I'll actually show you some information about that in slides moving forward. You'll see some of the concrete percentages around that information and concrete numbers. And it's also important to note that clinical trial data showed that both vaccines are safe and effective at preventing COVID-19. The two vaccines are not interchangeable. That's important to note. So if you have received the Pfizer in the first dose, you must receive the Pfizer vaccine second dose. Same thing with Moderna. If you have the first dose with Moderna's vaccine, you must have the second dose with Moderna's vaccine as well. So there's no interchanging. Again, here are the numbers. As of November 30th, Pfizer had 43,931, Moderna 30,000 were enrolled in their clinical trials. They had Pfizer had 150 clinical sites, Moderna 89. You see the racial distribution in terms of makeup of those who participated in the research studies as well as age. COVID-19 vaccines have the mRNA technology. These are vaccines that do not contain the virus. They do not contain the live virus of COVID-19 to be effective. The mRNA vaccines prompt your body to create an immune response that fights off the COVID-19 disease. So, in simple terms, because again, of course, I'm HR, I'm not a scientist, give it to me in simple terms. Basic technology, known as mRNA, is used to teach our cells how to make a protein that prompts an immune response without using the live virus that causes COVID-19. And once that immune response is triggered, the body then makes antibodies to fight off the infection. And so, give it to me in simple terms. These are simple terms that mRNA creates our own, or gives us the ability to have our bodies create our own immune response. And that is important to note. It's not a live virus. You're not getting inoculated with COVID-19, which I know that early on that was some of the misinformation that was sort of in the background, some rumblings of this. That is certainly not the case. The mRNA vaccine are expected to produce some side effects, or may produce some side effects after vaccination, particularly after the second dose. So those side effects include fever, headaches, muscle aches, but no significant safety concerns were identified in the clinical trials. At least 8 weeks of safety data was gathered in the trials, and it is unusual for side effects to appear more than 8 weeks after vaccination. And so it's important to note that one of the built-in components of vaccinations, with our partner Walgreens, is that, who, by the way, is using the Pfizer vaccine, is that built into that vaccination process is that there is a space that the person who has been administered a dose of the vaccine will go and sit. Everyone will sit in one room, of course, socially distanced, for 15 minutes to be observed to make sure that if side effects start to emerge, the pharmacist has EpiPens, Benadryl that can be administered on site, and if it requires more intervention from a medical team or entity, that we can make sure that person gets to a hospital if necessary. So it's not just the vaccination is administered and we send you back to work. You'll be observed. And of course, you should monitor yourself for symptoms. So you heard what the symptoms are. You'll be given a handout of information on the day of the vaccine as well in our vaccine clinic. But you should also monitor yourself for symptoms if anything starts to emerge. Um, People may experience the normal side effects, and it is important to note that it takes a few weeks for your body to build immunity after vaccination. I know I saw some people, and you may have seen it as well, where early on, where people were being vaccinated and they were like, oh, now I'm free. Sir, madam, not so much. You're not free yet. Your body still has to build up that response, as well as you need to make sure you're continuing to follow the COVID-19 CDC guidelines of social distancing, wearing your face mask, making sure you're cleaning and disinfecting common areas, and washing your hands frequently, because you want to make sure that your body not only continues to build that immunity past the second dose, even after the second dose, it takes a couple weeks to build that the full breadth of the immunity. It's 95% effective, but you want to make sure you are building toward that 95% and not become reckless. You're not 95% on the first dose, so keep that in mind. Still follow the guidelines. And I think since the first week that Pfizer began to administer the vaccine, people have become aware of that criteria and sort of began to understand that it's not a get out of COVID free card. I know it's not the best way to put it, but you're not free to do and be. You still must follow the guidelines and adhere to all safety and mitigating practices. Vaccine safety monitoring, in addition to that 15-minute observation period, in addition to being prompted to make sure you're monitoring for your own symptoms, they do have formal monitoring systems in place. One in particular for COVID-19 is called the V-Safe, and it actually is specific to COVID-19 symptoms and reporting. And you actually will be given a handout after you're on the day of vaccination, after you've been vaccinated, where you can, with your smartphone, you'll be given a QR code. You can join and sign up and then report any symptoms you may have, mild, although they may be. They still want to continue to collect data from those who are being vaccinated. And so, mild to severe symptoms, they still want you to report those. So, if you're having mild symptoms, you can report it in. If your symptoms are concerning or unusual, please report them. The CDC receives this information and may even contact you to get more in depth information if the information you supply to the system warrants a follow up by the CDC. And of course, if you experience true medical emergency kind of symptoms, heart rate, tightness of chest, if you're having difficulty breathing, anything, if you have a reaction to the vaccination, which um, would warrant further intervention by a medical provider. Report to VSafe later, and of course, immediately seek medical attention. Healthcare workers, those people working in the medical realm of healthcare, nurses, nursing assistants, those people are on the floor working directly with patients, will be the first to be vaccinated. This too is driven not only, of course, by the CDC guidelines of priority, but also the supply of the actual vaccine. It's not, I don't know what the plan was from the federal government, of course, but it's not as available as we may have been led to believe. There are limitations on the number of vaccines available. So we give priority to those people who work directly in the medical component of our organization with the residents. And then and of course, residents will have access to the vaccine as well. And then we shift once those people have had their vaccine secured, we'll widen the circle for other team members who meet the qualifications still under CDC guidelines to move into the realm of having access to the vaccine. We ask that those who are vaccinated to share that experience with other team members, with your family, with your friends, with your residents and patients. Why? Because we know that despite all we may hear on the news, despite all we may read on the internet, that one-on-one, I know you, I see you at work every day. You tell me I had the vaccine. I didn't have any um real side effects. Yeah, it was fine. That matters because you know this person, you've seen this person, you work alongside this person, and that experience matters. We had a nurse who was here for COVID testing um, recently, and she mentioned to me she had the vaccine. And of course, I took that opportunity because I'm curious to ask her a few questions. How was it? What was your experience? Did you have any side effects? Would you recommend other people get it? And she, of course, said she had a great experience and her arm was a little sore. But other than that, she's glad she made the decision. She knows it was the right decision for her and her family. And those are the kind of anecdotal experiences and pieces of information that really will be remembered by other people. So um, take the opportunity to share that information. And of course, the big deal about the vaccine is that it creates that immune response. So if you are exposed to the virus, your body can fight against it. And even if you, it will help you from becoming severely ill. Of course, HR, my experience with COVID has been people report positive tests to me and those sorts of things. So, of course, I've spoken to many people who were positive for COVID over this year. And some people absolutely have no symptoms. It's amazing, asymptomatic, not even a cough, not a sneeze, nothing. And then I've had employees, team members who were just ill, just sick. Thank goodness I don't know anyone who personally at work, I know personally, but not at work, who's died of it. And just, you know, just a real fight with those symptoms to get back to health. Um, and so this thing has its own way of being with each person. Each person has really a different experience with it. And of course, we know hundreds of thousands of people have died from COVID. And so these facts, they are facts. These facts should be considered when trying to determine for yourself whether or not to have the vaccine. On the day of the vaccination clinics, which are January 25th and 26th, that information has gone out to the White Horse team members. A couple of parameters around who will not get vaccinated. Just right off the bat, let's talk age. We do have team members who are under 18. The Pfizer vaccine will accommodate people who are 16 and older. Moderna, it's 18 and older. If you are currently COVID-19 positive, you will not be eligible to get the vaccine and you should not be at work. One. If you are sick on the day of the vaccine clinic, exhibiting COVID-like symptoms, you will not be able to get the vaccine. And again, you should go home. You should not be at work. The second, or in addition to, I should say, COVID, if you've had COVID-19 2 weeks prior to the vaccine clinic, which would put you around the start of July, second week of July, you will not qualify to be vaccinated. Just some interesting information about the vaccine hesitancy or from healthcare providers in particular. They did some surveying and found that 63% of the people through the American Nursing Foundation are somewhat or very confident that the vaccine will be safe and effective, which is good to hear. People are open to the information regarding the vaccine safety and efficacy. 34% would voluntarily receive the vaccine, and 57% are comfortable discussing it with their patients. The CDC web survey completed this fall shows that 63% said they would get the COVID vaccine. And typically, those people who are going to the CDC website are probably people who are actively investigating the vaccine and information to determine when the vaccine is available. Let me, sort of get my information um, prepared for myself so that as more information becomes available, I'm aware and making that decision in real time to make sure that I'm abreast of all that's going on with the research and that sort of thing. So I'm not surprised by that number for CDC people on the CDC website, right? So, how do you know if the COVID-19 vaccine is safe? So, we know that the FDA put both Pfizer and Moderna through a careful review of their data and their clinical trials. So, not only the data from the clinical trial, but even how the clinical trials are set up and who participated in those clinical trials. All that information was reviewed and the emergency use authorization issued as a result of being satisfied with what they found. It is better to get is it better, I'm sorry, to get natural immunity rather than immunity from vaccines? Well, we know the risk. I just spoke about it. I won't belabor the point, but we've all lived with information daily around the risk of COVID-19. And some of us personally, even if we didn't get it, we had friends and family who did. Um, and loved ones may have been really ill. Some people may have passed away. I know a couple of people whose family passed away from COVID. And we weigh that against, well, do we really want to risk our own immunity when we have a vaccine that can support our immune response so that we don't get sick and that we don't have symptoms? And so we have to weigh that against um, our own risk with what we deem as important when we evaluate that information. Because a lot of times with families, if you get it, it's not just you. You live with your family, your children. And that's always, of course, I've heard of these stories, and it's always so sad when your child or a child gets COVID and has to contend with those symptoms. So we're weighing all of that um, when we say, yes, I will get a vaccine, or no, I don't. So, or no, I won't, rather. We're weighing all of these potential scenarios or scenarios we've actually lived through. So, team members, if you have questions specifically about the vaccine, I ask that, or we ask that you go to the CDC website and that you speak with your physician if you think that is necessary and a necessary step. And if you do have underlying medical issues, if you do have a history of allergic reaction to vaccinations, then it is a necessary step to talk to your physician and evaluate all pertinent information and determine if you will be vaccinated. The leadership team is continuing to work closely with our pharmacy partner, who is Walgreens, who again will be administering the Pfizer vaccine. All of our team members working on the medical care side, personal care, Four Seasons, Sniff, Canterbury are eligible. We're starting again, as I said, due to the limitations on supply. we're starting with the medical providers. But after the reservations have been and the numbers have been determined for that group, they will be offered or may be offered to a larger number of team members outside of nursing, um, nursing assistants, those positions. We're asking that, well, we must have you register with HR prior to the vaccination clinics. A big part of preparation for the vaccination clinics for team members, unlike for residents, of course, they have medical history for the residents. We're at a deficit because, of course, we would not have team members' medical histories. But Walgreens requires that we have provided to them prior to the day of the clinic allergy information, medical conditions or underlying medical conditions uploaded into their system, and having been reviewed and prepped and ready for day of vaccination. So HR will hold 2 days, the week of the 4th. Information has gone out about those 2 days, where we will make ourselves available to team members to collect that information. We will also share frequently asked questions and try to answer any questions you may have. If we don't have the answers, of course, we're going to go back to our pharmacy partner and pose those questions on your behalf, to make sure you're as comfortable as you can be in receiving the vaccination. We want people to be informed. We want people to be prepped. So we'll also review the consent. Part of it will be filled out with insurance information. The other piece will be completed on the day of the vaccination clinic and before you're vaccinated, when you're talking to the pharmacist who will administer the vaccination, by the way. All right, so that's the information we need for that. Again, if you have questions about process, procedure, in-house, please come to HR. If you have questions around the vaccine and any concerns, do some reading on the CDC website. If you know personally you have medical issues or a history of allergic reaction to vaccinations, please speak with your personal physician prior to being vaccinated. It's a lot of information, it's a lot of moving parts, and we want people to be informed and ready. So please take the time to give consideration to all pieces of this process and make the best informed decision for you, your family, your community. And again, we hope you decide to receive the vaccination. And if you have any questions, contact Human Resources. You can email me directly at hjones@whitehorsevillage.org. You can call me at extension 5742. And we look forward to making this happen. Our leadership team is very excited that we have the opportunity to provide vaccines to our team members, and we hope you take advantage of it. Thank you so much.